Generative Adversarial Networks for Anonymized Healthcare of Lung Cancer Patients. Introduction. The paper discusses the concept of digital twins in healthcare systems, which involves creating simulation models to anticipate maintenance issues and improve performance. The authors focus on designing a behavioral healthcare model for lung cancer patients. They highlight the importance of data anonymization in healthcare data manipulation to protect privacy. The paper also discusses the use of generative adversarial networks, GANs, for data anonymization, which allows the generation of synthetic data that preserves relevant information while protecting sensitive information. The authors demonstrate the effectiveness of their approach in generating synthetic data for lung cancer patients. Materials and methods. The materials and methods section explains how the lung cancer patient database was used in this study. The database was obtained from a hospital in Spain and contained information on 887 patients with lung cancer. The data was cleaned and pre-processed using a generative adversarial network, GAN, methodology. The study also discusses how healthcare data can be converted into images to aid in the GAN analysis. The dataset included variables related to the patient's visits to the hospital, categorized into 4 groups with subgroups. The types of variables in the dataset were important for creating a suitable data trial for the GANs. Database processing. The database processing section of the research paper outlines a 3-step procedure for preparing the original database for use with GANs. These steps involve completing dependent variables, discarding variables with open response, and discarding variable data that do not indicate a duration. The variables are then subjected to statistical analysis, including tallying individual variables and conducting descriptive statistical studies. The selection criteria for variables are determined through statistical analysis and input from the medical team. The process undergoes a second iteration to analyze the chosen variables for anomalies and outliers. Results. In this study, a dataset of 886 patients with 64 features was pre-processed for use in a generative adversarial network, GAN. Missing values were present in the dataset, with 12.75% of values being missing. The maximum number of missing values allowed per patient was set at 21, resulting in a dataset of 804 patients. Missing values were also analyzed by feature, with a maximum of 317 missing values allowed. The dataset was then scaled and transformed for use in the GAN model. The GAN model architecture and training results are also described. Conclusions and discussion. This research paper demonstrates the use of synthetic health data, generated using a generative adversarial network, as a valuable resource for anonymizing healthcare records and creating digital twins. By capturing relationships across various features in real patients, the synthetic data can be used to generate models for digital twins while maintaining privacy. The study also addresses the challenge of missing values in medical databases and provides excellent results for key variables related to patient mortality and illness severity. However, limitations such as the selection of variables and potential loss of correlations are acknowledged. I leave you the link to the article in the description. Don't forget to subscribe and turn on the little bell.